Hello, this is Dr. David Green, CEO of the Mid-Atlantic Pain Network. Today's topic is what you need to know about trigger point injections. A trigger point is a tender and painful area of muscle. It's a hyper-irritable spot in muscle that's associated with palpable nodules in a taut band of muscle fibers. It can manifest as a tension headache, tinnitus, TMJ, decreased range of motion in the legs, low back pain, so it's a pretty varied presentation. Palpation of the trigger point typically elicits pain right over the affected area, and it can cause the pain to radiate around that area. So a trigger point injection is an outpatient procedure. It's given into the trigger point. It can be dry needling, which is basically an empty syringe. It could be some numbing medicine and also possibly some steroid medication. You don't need image guidance because it's such a superficial injection. The needle's not going very deep. Who does the injection help? Well, those who have myofascial pain, which is chronic pain in muscle tissue, fibromyalgia, tension headaches, tinnitus, TMJ pain, low back spasms, and more. The procedure takes a few minutes. The needle is placed right into the area that's tight. Usually the physician will see a small twitch and feel it as well. With dry needling, as mentioned, there is no numbing medicine or anything injected, or they can give both the numbing and the steroid. The reason dry needling is sometimes used is because the needle itself can relieve the trigger point pain, and it can be moved in and out of the affected area. The injection can be repeated every few weeks as needed. What are the results? The results are excellent in most patients for relieving the pain. For instance, if a person has sciatica and they have low back spasms as a result of that, trigger point injections are great. There's really been no large-scale studies looking at them. The great news is that they are often effective with no medication. It's a very low-risk procedure and a very high benefit. So there's really no particular downside. Are there risks? Minimal. The needle's not put very deep at all. The biggest risk is that it may not work. There's a very slight risk of infection, allergic reaction. If it's used too often with steroids, it can absorb some fat and leave a dent in the skin. So if it's going to be given, a decent amount of the time, steroids should be avoided. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics in the network in the area. Over 50 insurances are accepted, with over 25 treatment options being provided by the board-certified doctors. Visit us online today at midatlanticpainnetwork.com, and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Green with the Mid-Atlantic Pain Network. Your pain stops here.